Good day, everyone. I'm Dr. Gomez Chua, and we will be discussing a little bit about how to support students and their mental health during the school opening. So, it is important to understand that the COVID 19 pandemic had an impact on nearly everybody. So, some short term effects that were documented in a systemic review about students during the pandemic were anxiety and depression, some problems with eating or sleeping, and some difficulty with social interactions, especially due to the education and being locked down. So it isn't really known how this will translate into long-term effects on children's mental health. Normally, these kinds of situations involve an approach based on cognitive behavioral therapy to help manage disruptions and learn better behaviors. But then, since this is a very unique and very widespread event, another approach has to be taken by schools with helping their students and their mental health. So, key to this is acknowledging that everybody has had some form of trauma from the COVID 19 pandemic. By acknowledging this trauma, schools can move forward in learning how to help their students as well as staff members and other community members involved in the school opening. So, how does one address trauma for students who are returning to school? The first approach is to foster safety and equity. So this involves reassuring them that school is a safe place, that they won't get sick in the school setting, or that they are less likely to get sick in the school setting at least. This involves empowering students with behaviors for safety, such as having hand washing, wearing masks, and other behaviors that may help reduce transmission of the pandemic or the COVID 19 virus. And this also includes having marginalized sectors involved in the planning for reintegration. So this involves students who are in SPED, involves those who can't return right away because of distance, and other people who may be marginalized due to the pandemic. So this flows naturally into building community. The school should be made a welcoming venue for students. It should be a place to build relationships and friendships with students, staff, and other community members. This can be done through mentoring, having opportunities for service and altruism, and also by including parents and other stakeholders in the reopening process. Part of this involves having a network of partners in the community for mental health. These can be resources, such as speakers, other practitioners. This is also very important for referring red flags that have been discussed in a previous module. So if any student has these red flags, it is important to know where they can go for additional help. Another aspect is also reintegrating students who have had to take a leave for mental health reasons. So say a student has been referred for a red flag and has to take leave of absence. It is important to make sure that this person will not be left behind in the school opening process. It is also important to acknowledge that everybody has had a form of loss during the pandemic. This could be a loss of a family member or loved one. This could be a loss of a job. This could be a loss of a friendship because of distance. And grief is a natural reaction coming from loss. So it is important to have a place to open up and address grief in the school setting. Teachers can refer each other or students to support groups for bereavement, and also practice empathetic communication when discussing loss. This involves acknowledging what students are feeling, using age appropriate language to discuss death and difficult topics, as well as having a way of helping the student move forward and address grief healthily. So, other interventions involve having routines and connections. So, this means having activities that occur on a regular basis, having help for transferees to schools, as well as ways of building memories. So, this can be a way to have time for students to interact, to do something together. Another way to help students is to also practice mindfulness. So, first is to reduce screen time on devices and encourage practices such as journaling and meditation or having quiet time to simply be in the moment. And lastly, schools should have a better vision for the future moving forward. So, this is a way to include more stakeholders in making a new mission vision if needed, and to support creativity and innovation from everybody involved in envisioning where the school will be after this pandemic. So, to summarize, it is important to acknowledge that everybody has had a disruption or trauma from the COVID 19 pandemic. Therefore, to help the reopening process, schools should be made safe and welcoming for those who are returning. It should be a place to rebuild memories and relationships. And lastly, reopening should be inclusive of stakeholders and it should include parents, community leaders, and even students. So this is a way for students and the community to move forward towards a better normal in the pandemic.